All right, let's talk about something every healthcare leader is thinking about: software modernization. We're all under pressure to deliver better care while wrestling with tech that sometimes feels stuck in the last century. So, what's the first practical tip? Start small. Don't try to overhaul everything at once. Pick one workflow, maybe patient scheduling or e-prescribing, and make that your pilot. It's way easier to get buy-in and spot pain points early when you're focusing on a single process. Next, involve your frontline teams from the start. They're the ones using this tech every day, and their feedback is gold. One real-world example: a hospital I worked with brought nurses into software selection meetings. The result? They caught workflow snags before rollout, saving everyone headaches down the line. Tip 3. Don't underestimate integration. Modern tools are only as good as their ability to play nice with what you already have. If your EHR can't talk to your new analytics dashboard, you'll just create more work. So push vendors on interoperability, not just shiny features. And finally, stay agile. Tech is always evolving, so frame modernization as an ongoing process, not a one-off project. Celebrate small wins along the way, and don't be afraid to pivot if something isn't working. Modernization doesn't have to be overwhelming. With the right mindset and a few practical steps, you can make real progress without burning out your team or your budget.